Based on the findings in case number 3, I've came to the PT diagnosis of lateral epicondylitis of the right elbow. And in order to begin treatment, the first step I would do is a transverse friction massage. And I would do this massage over the lateral aspect of the elbow, over the tendons of extensor carpi radialis brevis and extensor carpi radialis longus. What I would do is use my 2 fingers here over the lateral elbow, and I'm going to slowly move back and forth, but I'm going to keep the 2 fingers stationary on the skin, so I'm not rubbing skin, but I am rubbing my 2 fingers over the tendons that I mentioned earlier. And I would do this for 8 to 15 minutes, just to get a little bit of stimulation to the area and better improve healing. The patient in this case also presents with a slight flexion contracture. He's lacking some full extension on the right arm. So an exercise that I might do in order to help this out a little bit is to have the patient, what I'm going to have you do is hold the weight out here and just let gravity take the weight and don't move your arm, and just hold it there and let it try to stretch your elbow out and do extension. And just hold that for a couple seconds, and then I'll tell you to relax. And you can go ahead and relax. Okay, hold it. Hold, and then relax. And then go ahead and try again. And I just want to go ahead and relax. I just want to let the weight do work on the elbow, helping to utilize gravity and pull it into further extension. But I don't want the patient to go to higher levels of pain at this moment. I just want them to slowly get a stretch, and hopefully we start working on better extension. The patient in this case also presented with the lack of range of motion in supination, some lack of range of motion with pain at end range. And an exercise to do this, what I'm going to have you do is take the hammer here, and I'm going to have you slowly lower it down to the ground and let gravity take it. And I don't want you to move your wrist, but I want you to let the hammer move your wrist and let it pull it a little bit. And once you get to as far as you can go with your pain, go ahead and bring it back up and relax. Relax for a few seconds, and then go down for 5 more seconds and hold that. Okay, so just let it drop down. Okay, if it starts to hurt, hold it there for 5 seconds. 1, 2, 3, 4, 5. Okay, and bring it back up. Take a break for a second, and then let it back down. Patient in this case also presented with a 3+ out of 5 MMT for thumb extension. So what we're going to work on is a little bit of strengthening exercise, some manual resistance for the thumb. So what I'm going to have you do is I'm going to brace your thumb right here, and I'm going to have you pull back towards you, and I'm going to be providing some resistance for that. So go ahead and pull back. Okay, and now I'm going to pull towards me, and I want you to slowly let me pull your thumb towards me. Okay, and pull back, and then slowly let me down. And by bracing my finger on the proximal phalanx of the thumb, I can be sure to highlight the extensor pollicis brevis muscle for thumb extension. And then I can also I would be getting both the eccentric and concentric components of that muscle. And then the case did not specify which thumb extensor, so it could also be extensor pollicis longus. So for that, I could stabilize here and only work on the distal phalanx. So go ahead and pull your thumb back towards you, just the tip of your thumb. Okay, and relax, and do that again.